Okay, my name is Keith Baker, and thank you for giving me a second opportunity to speak to this committee. I also want to thank the committee members for serving and for all their efforts and hard work. I'd also like to thank Dennis Magnum for getting a workshop done. My family, we all remain ill after it's been 24 years now, and there's still no test, no treatment. My experience with this disease since we all started suddenly is that it can be contagious and it can occur in clusters. Today I'm able to work part-time, but I still suffer greatly. My sister can work off and on. And sadly, my brother can't work at all, and he hasn't been able to work or finish school since he was 13, which makes me the most sad. What makes this illness so hard to live with? Literally hundreds of things. I found the cognitive and mental symptoms to be the most difficult. Our short-term memories and ability to focus just aren't there anymore. When I first tried to go back to school is when I really noticed this. Before I got ME, I was a good student and good at math, but when I went back to school, I found paying attention to math almost impossible. It was like that part of my brain just no longer functioned anymore. Then there was the belief, the lack of understanding from doctors. My doctor that I have now, I asked him, I feel like I have an infection. I'd really like to see an infectious disease doctor, and he told me I would be wasting my time because half of them don't believe in CFS and just not even to bother doing it. The lack of support from friends and families due to education and public awareness, the lack of all these factors just sort of snowball in this disease, and it's terribly hard for people to live with it and find a way to survive in the world. So what can be done to help people with this illness? I think first off, as Dr. Jason always keeps saying, it needs to be defined properly, and use of the Canadian consensus criteria for ME researchers need to be used to identify cohorts to study, as well as experienced ME researchers. I also feel cohorts of outbreaks need to be looked at hard also. The hallmark symptoms of this illness are cognitive symptoms and post-exertional malaise. They should be the primary symptoms for inclusions. The CDC empirical definition, in my opinion, should be abolished, as it includes too many people with major depressive disorder, and it was in part created by an associate professor of psychiatry who believes CSF is a functional somatoform disorder. As to my horror, I discovered when I looked up her bio on the internet. Secondly, the obvious one, funding needs to be increased and put on par with an illness such as MS that causes a similar amount of disability and suffering. When there's a natural disaster, this country is known for being compassionate and generous with its funds. This disease is a natural disaster hidden in the shadows, and it deserves at least $300 million in immediate funding, and it really should be given more due to the decades of neglect. The 5 Centers of Excellence the CIFSAC repeatedly recommends need to be part of this increased funding. These centers are needed for a place for treatment, research, and clinical trials, which are so desperately needed. Also, again, Ampligen needs to be made available out of compassion, as it has and continues to help patients. In addition, I think it is imperative that the Whitmore-Peterson Institute receive more funding immediately, and the need for a precise replication of the work, in my opinion, I just haven't seen that done yet. As someone who has some experience with psychological research, I know that changing small details in experiments, such as even wording in a questionnaire, can lead to totally different results or answers. Sometimes I feel like the devil is in the details, and I would imagine that effort to be even more true in cutting-edge retroviral research. We've been told for years that the reason that not many meritorious institutions, reason we don't get enough funding is not enough meritorious institutions apply for grants or write good grant proposals. I find it as odd that the Whitmore-Peterson Institute hasn't received a grant since the science paper, since we know they got a grant before their finding of a retrovirus, and also we know they can write a good grant because they did get a grant before the science paper.
Keith, you have about a minute left.
Okay. It just seems unfair to me, and I think it sends a bad message to other researchers who want to study viruses in this illness. I've seen this before with people trying to get grants to study viruses such as EBV, HHV6, and the retrovirus Elaine DeFreitas had worked on. So probably the meritorious applications haven't been there for years to CFS subpanel because researchers have just given up at some point. I would add, when you look at the CFS subpanel, you see many dentists and psychologists, and it makes little sense to me for a neuroimmune disease to be composed, subpanel to be composed of dentists and psychologists. And I would like to also add that it needs to be addressed, the study of the long-term risks of patients with ME have. I find it neglectful the CDC has not done a study on this so we can protect ourselves from possible secondary conditions we may be at risk for developing. And please, will someone study families with CFS? I see polls on the internet where 30% of people with CFS have a close family member who also has CFS. Why is this?
If you could please wrap up, Keith.
Okay. Obviously, epidemiologists need to look at the families and at the outbreaks and study some basic questions about possible contagiousness. Okay, thanks. I'm done.
Okay.
Okay.
Thank you so
Bye.
much, Keith.
Yeah.
Take good care.